Good morning, everyone. My name's Rebecca, and it's a pleasure to be here with you this morning to talk to you about nutrition education and counselling. So let's just go into a little bit about my background. Before we dive into this topic. My background is I'm a registered nutritionist, registered associate nutritionist. So I have my undergraduate in nutrition, and then I went on to go and study nutrition and genetics. This is quite a unique subject. I was very passionate. I'm very passionate about personalized nutrition and what impact this has on the outcomes for clients. I believe that it helps people to have better outcomes when they know that particularly results are personalized to them, and even down to their DNA. That can really help to provide that motivation for people to make that change. And we'll talk about this a bit more later on. My work is as a freelance nutritionist. So I work both with brands as a consultant. So I help to formulate different products, particularly personalized nutrition brands. So whether that's personalized green powders or genetically personalized brands. And also I love working one-to-one with clients too. This is primarily in the area of gut health and hormonal issues, and DNA testing as well, of course, is my particular specialism. So let's go into a quick introduction for nutrition education and counselling. So as we know, one size does not fit all when it comes to nutrition. So obviously, just as people can look and behave differently, our bodies can obviously react pretty differently to different foods, and we're all very different in the way that we respond to different techniques of receiving nutrition education as well. We'll talk more about those different techniques later. But really, nutrition education and counselling is to empower individuals to make really informed dietary choices. And of course, we want those improved health outcomes as well as a result. So first, talking a bit about nutrition education. So I'm just trying to remove a screen, 1 second. Nutrition education obviously presents more general, it can either be general or specific information related to health and nutrition. So this might be in groups, particularly in community settings. As an example, I led some type 2 diabetes education in Fiji around schools, workplace settings, community halls, all these different areas, and they all require different types of strategy to target these different types of audiences. Obviously, we're looking at school-age children. We're looking in workplace settings such as the Fiji sugar factory. So these people obviously working for a huge factory producing lots of sugar, and lots of them weren't aware really even the links between sugar and diabetes, despite even working for the Fiji sugar factory. So we had all these different talks that we were doing, and obviously adapting our resources based on our audience in front of us. So for example, visual aids were particularly important for children, and we wanted to show them how much sugar was in certain types of foods to educate them about type 2 diabetes in that way. So educators might be nutritionists like myself, trained counsellors or health educators, maybe nurse specialists as well. So they're going to be delivering prepared talks on different types of topics. So different nutrition education techniques. So effective communication is absolutely key when it comes to educating people about nutrition. It's top, really the most important skill of them all. So we need to be clear, concise. We need to be non-judgmental in our communication, and motivational interviewing as well. Techniques are really important to help engage clients and to realize their motivation for changing, and try to elicit that from them rather than us telling them what they should be doing, but kind of them arriving at that destination on their own with our guidance. So we obviously have to tailor, as I was saying in the last slide, we have to tailor our information to different audiences based on their background, their literacy levels, their age, socioeconomic background, all of these things, access to food. So, and as well, incorporating technology and multimedia. So we obviously live in a digital age now, so we can very much utilize tools like digital tools and platforms, social media, apps and things to enhance our nutrition education efforts. So we will talk about more of those as well shortly. So of course we have our common nutrition challenges. As I was saying, my specialism is in particularly in gut health and hormonal issues and personalized DNA testing. So, these are, for me, digestive issues do come up a lot as common problems for individuals. But sometimes before we get to that point of uncovering digestive issues, it might be that someone wants to first look at weight loss, for example, energy balance being a huge one of see calories consumed equal calories expended. And obviously an imbalance in energy intake and expenditure can lead to weight gain or weight loss. So of course, a lot of people do come to nutritionists for weight loss. That's going to always be the case. So that's going to be a large part. I mean, I do deal with weight loss as well, usually as a kind of byproduct of some of those issues as well. So it kind of comes along with a package of other issues that people might come to me with. So healthy eating patterns. So obviously a lot of people want to make sure that they are having a balanced diet. And this is where personalized nutrition come in, because we know everyone's going to be different in what a healthy eating pattern looks like for them. But we can talk about principles of portion control, moderation, mindful eating. All of these are just really important pillars of nutrition to make sure we're getting right before even you're going into anything more complex or kind of looking at the details. You need to make sure those foundations are all there. So promoting things like consumption of nutrient-dense foods. We're talking about our fruits, veggies, whole grains, lean proteins, and healthy fats as well. So we might be helping people to do meal planning. I do a lot of meal planning for clients, actually. And some people find that very helpful. Not everyone does, though. Some people want that kind of real hand holding and really want it laid out for them exactly what they should be eating and when. For others, that's going to be too much and too overwhelming. And then physical activity, of course, I mean, we're not, as nutritionists, not necessarily experts in physical activity, but that will, of course, be a role that, or we can't talk about achieving health without physical activity being a part of that picture as well. So yeah, regular physical activity, particularly for weight loss, is going to be particularly important to have that in mind. So those are sort of more general ones. And then in terms of like actual specific nutrition deficiencies and imbalances, what I commonly see will be omega-3. People won't be consuming enough of that. Vitamin D, most people are not consuming or not getting enough, or not taking a supplement, and certainly not getting enough during the winter months. And iron, calcium, magnesium, vitamin B12, these are just some examples of particularly common nutrient deficiencies, particularly for those who are plant-based. Obviously, with B12, if you'll know, in the plant-based diet, it's particularly difficult to achieve a good amount of that, or really to get it at all from a vegan diet. So, but even those who aren't vegan will often actually be deficient in some of these nutrients like vitamin B12, just because of our food manufacturing processes. Actually, often we're not receiving the same nutrition that we might have done maybe a couple of decades ago. So yeah, thinking about things like absorption rates, why some people might be not absorbing some of these nutrients properly, and perhaps have just higher nutrient needs. For me, that's where DNA comes in as well. And we look at their absorption of certain nutrients. But even by looking at if someone's really fatigued, they've got anemia, they've got low immunity, they're feeling weak, those are also signs that they are lacking in some of these key nutrients. So I would, wouldn't even need to, do anything like a DNA test to start looking at some of these nutrient deficiencies. So strategies for correction. So we could look at if someone's plant-based, consuming fortified foods that have vitamin B12 in, for example, like plant-based milks. Here in the UK, we have lots of fortification of those products, vegan products, which is great. So it does help prevent these deficiencies. And talk about certain supplementations that people might need. Omega-3, might recommend a supplement of omega-3 if people don't like consuming fish, which can be quite common. Vitamin D, most people will need to take a supplement of this at least during October to May. So we might even want to talk about medication use and digestive issues, even things like alcohol, which can actually prevent proper absorption of some of these nutrients as well. So you don't always have to do things like blood tests either to get to help people with these sort of issues. It's just, again, following up on these problems, having those check-ins with people to follow up progress, basically, and adjust any supplements that they need to take. And then for special populations like children, elderly, and athletes, obviously have specific nutrient requirements as well. So for example, children, we need to make sure they're having really balanced meals and snacks to help support their growth, development, and helping to get them involved in even things like meal planning and cooking, and helping parents to foster that sort of environment of cooking food and modeling that sort of positive eating behavior as well. Creating that supportive food environment for children is really important. So elderly is what have usually quite decreased appetite levels. They might have impaired nutrient absorption as well, dental issues, making it difficult to chew or swallow. So, I don't personally deal with the elderly, but that definitely presents, this segment of the population definitely present their own issues. They need particularly to make sure they're having protein-rich foods, calcium-rich foods, and also physical activity comes into this one as well for the elderly. It's really important. And then athletes, I don't particularly deal with athletes, but sometimes I will have someone who's particularly wanting to focus on their sports nutrition. So macronutrients, micronutrients, all these balances are really important. Hydration, nutrient timing, all super important for their actual performance and their recovery too. So now going on to nutrition counselling. So nutrition counselling is more of a two-way interaction through which a client and a trained counsellor or nutritionist will interpret the results of a nutrition assessment, identify individual nutrition needs and goals, and discuss ways to meet those goals and agree on next steps. So with nutrition counselling, we're really aiming to help clients understand important information about their health, really, and practical actions they can make to address these goals that they have. So behaviour change is going to be a big part of this. And these people who could conduct this could be nutritionists, like I said, nurses, or facility-based providers, or community health workers or volunteers, for example. So key skills to learn as a health professional. So these are just some ideas I kind of came up with, as myself as a health professional, that are really important, I think, as we're dealing with clients. So listening skills, really critical and much harder to do than it sounds. And maybe we don't get much training on it. I don't think I really got much training on this during my undergrad and masters. It was so a lot of theory based and not a lot of practical application, dealing with clients one-to-one, which perhaps would have been really helpful. I've learned this now as I'm kind of 5 years into my career, that good listening skills are paramount. So one good, I should have written this down, mnemonic that's useful for this is OARS. So think about open-ended questions, affirmations, reflections, and summarizing. So we're trying to avoid obviously just yes and no answer questions. We're affirming what the person is telling us. So we're empathizing kind of with what their issue is. And we're reflecting that back to the person. So then they can confirm that we've understood what their issue is, or they can add in anything that we might have missed, and then kind of summarizing in total what it is that they want to achieve. And then develop empathy. So I touched on that just in the last point. So empathy is obviously the ability to imagine what it feels like to be the other person. So continually developing this skill and demonstrating it is really necessary when working with people who are trying to change their behavior, which is going to be a lot of the time what we're dealing with nutrition clients. So unlearn the writing reflex, so also known as the expert approach. So whilst those listening skills are not usually taught to us as nutritionists or other health professionals maybe, developing a sense of expertise, I guess, is rewarded and encouraged. So when we're working with clients who are like a bit on the fence about wanting to change, it's really important for us to resist the urge to provide, the perfect solution. So we have to step back and really make sure we're not telling them what to do, but we're guiding them to that point themselves. So they reach that. It's part of the motivational interviewing skills as well. So apply adult learning principles when sharing information. So it's shown that adult learners retain and act on information best when they're motivated and when the information is necessary to know. So, and also when it's based on prior knowledge and experiences. But yeah, they have to be ready to receive this. And yeah, it's really, really key to remember those factors. So they've got to be motivated. The information has to be necessary to know. And it has to be based on prior knowledge and experiences, and they have to be ready to receive this, and also problem-centered. So yeah, remember those when you are informing your clients. So building accountability, this one you'll probably know is really key. So any kind of intervention with no plan for follow-up or accountability is pretty unlikely to be sustained. So that doesn't mean that clients always need to be accountable to you, but we should be helping clients develop systems that will help them keep accountable to themselves or to others. So it doesn't mean we always have to be having follow-ups, but yeah, they do need some way of staying accountable to themselves or others, or having other people around them, family members, to help keep them on track. Because everyone falls off the wagon, right? It's totally normal, and it's human nature. But it's just how we get those people back on track as well. It's really important, and not kind of motivating them as well to think that, a lot of people think, oh, I'm just going to throw in the towel, but we must make sure that people don't do that, and we get them back on track as quickly as possible. So here are some tips that I've come up with. So the foundation, I guess, of effective client relationships or counselling sessions is asking questions about the client's symptoms and situation, to be able to give you appropriate information back to them and support them to make healthy choices at home. So just telling people what to do does not mean that they'll do it, unfortunately. If only it was that easy. Because knowledge isn't enough to change behavior. We need to know what messages and questions are appropriate for people, and also prioritizing those messages and questions that we ask them is really important to make sure we're not overwhelming them, but actually putting the most important questions first, and things and points that we're going to help them hope improve, and not just overloading them with too many things that they can deal with. At the end of a call, I usually say, if it's weight loss, give them 2 to 3 actionable steps at the end of the call for our next follow-up. So, and try to not make it too overwhelming for them. And I try and kind of make it fun as well, if I can. So I have an app that kind of people can like tick off when they've achieved, whether it's doing 8,000 steps a day, and they can kind of like, these apps sort of like gamify it a bit, so they make it kind of fun. When you've ticked them off, you get these points come through, and anything we can do that makes it more motivational, the better. So sorry, I've gone slightly off topic there, but so tips are, so do more listening than talking. Yeah, like I said before, it's much easier to just talk at people than be a really good listener, and asking open-ended questions, not just questions clients can answer with a yes or a no answer. And when we repeat back to them, we repeat what the client said to us back to them, so we make sure that we really understood them properly. We take interest in them, we empathize with their problems and their situations, showing like genuine interest and care for them, which is probably, as a nutritionist, that's why I'm in the field, because I actually really do care about people's health, and I get a lot of enjoyment from seeing people make health improvements. So I think that comes naturally if you're in this field anyway, and if you're interested in this, then you're probably that kind of empathetic sort of type of personality anyway. So we also want to avoid judging clients, of course. So people think that as a nutritionist, we're going to judge them if we see their food diary and it's full of fast food. That's why people don't necessarily, they're not very truthful in their food diaries, because we think as nutritionists that we're gonna judge them harshly, but actually that's just not the case. We're just there to help them. Yeah, it's I try and tell them that it's only harming them if they're not completely truthful on their questionnaire. It's not harming myself, it's more for them. That it's really important they sort of try and do it as accurately as possible. So yeah, listen to what clients think, respect their feelings, even if maybe their beliefs need a bit of correction, or what they've read about. I think I saw an article about bananas being like Mars bars, and if someone says bananas are bad, I'm going to want to correct them and say, actually no, they're really not. But sometimes we need to take a step back and let that person put their point across before jumping in. So that might sort of lower their confidence to then speak up later on in the conversation. So we obviously have to praise them, tell them, affirm when they're doing things really well, and give them that motivation to keep going. And suggest actions that are appropriate basically for clients given their situation. So we're not telling someone who lives an hour away from a supermarket they need to maybe get loads of fresh fruit. Maybe we're going to rely a bit more on frozen fruit or something, or canned vegetables, and being realistic with what people can do. Also, they don't have a car or something, and not expecting them to maybe do all their food shopping from one place, for example. And you're only giving a little bit of information at a time, so not overloading them, not overwhelming people. People really can't take on too much at a time. It really has to be quite bite-sized information. Using simple language, trying not to confuse them with any jargon or scientific terminology. I think I struggled with this a bit actually after studying, because I was so used to writing essays and assignments using very complex language. And actually, in reality, that's not going to be helpful for most people. Aren't going to connect with that at all. So it's tempting, because you also kind of want to show that you're competent, but that's not going to be the way that people are going to build trust in you. It's going to be much more about the way that you interact with them, rather than the fancy language you use. And give suggestions, not commands. Yeah, really important to make sure we're not you have to do this, you have to wake up and have, make sure you're having your 30 grams of protein first thing. I know that that just does not work with people. They do not want to be told what to do. So behavior change, it can be a long process, a 6-stage process to be exact. So this is the behavior change, or one of the most famous behavior change models. There are several out there. This is called the trans-theoretical stages of change model. So it helps us, it's a helpful reminder that behavior change is a journey. It's definitely not linear. You know, it's not necessary that we're going to go through all these stages in one nice, neat line, you know, going from pre-contemplation to maintenance. It's likely we will relapse a bit, or we'll switch between stages in the cycle. So obviously, as I said, it's become clear that expert advice does not translate into behavior change for people who are not ready to change. So as a result, we have this kind of model that explains a bit the stages that people typically go through. So pre-contemplation, these are individuals who have no intention at the moment to make a change, and they may also be unaware that they need to make a change. So a lot of people are in this stage, and maybe it might be a health scare that people have that then gets them to the contemplation stage, or maybe they've had a doctor's visit and they've been told that they need to lose weight before they can maybe have a bariatric surgery or something like that. And yeah, that's then when they become more interested in and motivated to make change. So then we go to the contemplation stage. So individuals are aware of a need to change, but maybe are not committed to it yet. So yeah, a lot of people in that stage as well. A lot of people know they need to make healthier decisions, but not quite there yet. Sorry, just bear with me a moment. I've just got to pop my laptop charger in because I thought I had a lot more charge on it. Give me a moment. So now going on to the preparation. So this, if you can read it, it's this orange one, it's a bit difficult to read. So individuals then have an intention to change and may be planning steps to make it happen, but they haven't really kind of got to the actual action of it yet. So might include goal setting and planning for what they're going to do. So this is probably where a nutritionist will come in, or someone will come to this, a client will want to see a nutritionist at this point, probably, to have some guidance on this, on what they need to do, on what action they need to take, perhaps, or they might do it themselves. So on the action stage, obviously individuals are then committed and they're taking action to make a change, which is great. But yeah, this is when sometimes people will fall off the bandwagon at this point. So relapse is often what can happen despite making the action to make a change. Obviously it does take time for new habits to stick. So individuals will often kind of revert back to their old ways, even if it is just temporarily. It is very common for people to go back to what they were doing before for many reasons. Either they weren't, they didn't have the support they needed, or different, various things. It might take people a few cycles of this to really get into the maintenance stage, where changes are sustained and a new behavior has been fully developed through repeated action. So this is obviously the goal. This is what we want. So we think of yo-yo dieting, for example. Often we're going to go in this stage of maintenance. People are going to get the results that they want, but they're not going to then keep that behavior going, and then they're going to relapse, and then they're going to be in this constant cycle, which is not what we want. Obviously, that's not a healthy way to be for many reasons, for their health, or and mentally it's not great for them either to kind of have that lack of self-confidence that they can keep the results that they've achieved. So if any of you work with if people at all, yeah, we can use this model for many different things in life, not just for nutrition behavior change. It definitely explains human behavior in a lot of different scenarios. So, how can dietary monitoring, for example, support patients to move towards maintenance of sustained behavior? So this is where we're monitoring and helping people to stick to their maybe their goals and their diets. So yeah, loads of different behavior change techniques have been identified. We call these kind of BCTs, behavior change techniques. And there's like over 40 different techniques actually in total. And overall research definitely is quite sure that combining different approaches, different behavior change techniques is definitely a lot more effective than using them alone in isolation. So let's talk about some of them. So dietary self-monitoring, these are going to be the three sort of main ones. So dietary self-monitoring, think of things like kind of like a food diary. So this picture here, this is going to be your typical dietary self-monitoring, which enables patients to recognize a need for change, identify how change can be achieved, and monitor progress towards their dietary targets. So I would probably say that a food diary is quite limited. It's maybe not going to help them really identify, maybe without help, what changes are needed, or maybe monitor progress towards their dietary targets. It's going to be much harder for people to do this on their own because they're not going to have the motivation really as well, perhaps to do this long term. It might be that, for example, if we're doing a 7-day food diary, I wouldn't normally recommend a 7-day food diary because people don't generally do it very accurately for 7 days. 3 days is generally the length that's used for research, because you'll do 2 weekdays and 1 weekend, and that 1 weekend day, because people generally can stick to that reporting for that long relatively accurately, not always completely. But it obviously can be really time consuming and inaccurate. And that is the problem. But even with 3 days, people are still going to get fatigued from it and not accurately do it. So there are other methods. There's new technology coming out where people can take a photo of their food, and it will kind of, AI will analyze what they're eating. And so they don't actually have to do it themselves, which is great. I'm not sure on the accuracy of this. I haven't used them yet, but I think AI is going to be very helpful in this. And it's going to be very useful for research as well, because this is a major issue with any nutrition research, because we will never know how accurate these dietary self-monitoring techniques really are. So the next best thing is a digital diet and nutrient tracking tool. So think of things like MyFitnessPal, which you've probably heard of. It's like the #1 app really for tracking food, calories, macros, micros, all of that. So the good thing about this is that it's quite accessible to people. So it's going to help engage hard to reach groups. Most people have a smartphone now these days, even in developing countries. So most people are going to have access to this. But then, what do people do with this information is an ongoing question. And then is this, there's also a conversation of whether this going to be helpful for people to be stuck in perhaps a tracking their food kind of way of living, where they're perhaps becoming a bit obsessive about weighing their food, or making sure everything is tracked, and that can be a problem. This is called like orthorexia, where people are a bit obsessed about eating very clean and making sure their calories are fit within their goals. And I mean, that's a whole nother conversation, but that is the problem with these kind of apps being so widely used is people do just do use them long term, perhaps when they don't always need to. So now going on to personalized feedback. So this is really my area of specialty, and really where I'm very excited about where things are going, because I think personalized feedback from research has been identified as a key component for dietary behavior change. So it's a lot more engaging for people to make changes when they know that those changes are personalized to them. So yes, things like Zoe, I don't know if in the UK and the US, Zoe is very well known. So you probably have come across them. They do blood glucose monitoring, and they become very popular with people to help people analyze their blood sugar readings and help them personalize their diets based on the feedback that they're getting from the app, which is like real-time data that's telling them what their blood glucose is doing. And I've actually just been doing this the last few weeks. I have to say it has been very interesting. So I have gained a lot of insight from my blood sugar readings. And I can see that for some people, this is going to really help motivate them to make those changes, because it's all very well knowing that perhaps white bread and a glass of orange juice isn't going to be the best option for breakfast, but actually seeing what it does to your blood sugar is going to be a whole nother story. It then becomes very real, right, when you see the data in front of you. So I think this has big, powerful potential, this kind of personalized nutrition industry. And I know I'm biased because I think it's absolutely fascinating, this area, and I think it's only going to get bigger and bigger, and it's the projection for the field is huge. And yeah, obviously it's resonating with people, but we have to think about the drawbacks as well. So this is not accessible to everyone. It's expensive, and as a result, this could widen health inequalities around the world. And we have to think, what's something that's going to be able to be implemented at a public health level for people, that's going to be something that most people can implement. And at the moment, these kind of dietary tracking devices are not going to be possible for most people. We call them the wealthy well. So a lot of people who have the money to buy these kind of things are generally not the ones who actually need to be doing it. And that's another conversation, really, as to whether this is something really that overall that should be in a way promoted, or whether it's not going to be implemented on the public health level anytime soon. So same with DNA testing. A lot of people, it's quite a elitist kind of thing that not many people can afford. And yes, it is powerful, the data in it, but so it's just an interesting discussion. So I'd like to know any of your thoughts. I'll be interested to hear any questions you have on that as well at the end. So moving on to counselling skills for nutrition professionals. So these are just a few that I picked out that I think are really important. So building rapport and trust. So when you've got a client coming in, whether it's in person, or probably more likely online now these days, as most of mine are online, really important to create a welcoming environment, of course, active listening, empathy, things that we've spoken about earlier, and assessing dietary habits and behaviours. So collecting dietary information in the best way you can. Food diaries, like I spoke about, the 3-day food diary, and I didn't touch on the 24-hour recall. So this potentially is better, arguably a better way of getting people's dietary analysis from them. So you ask people, or they fill it in themselves, in the last 24 hours, have you had a source of whole grain carbohydrates? And then they say yes, and then they might tick, had whole grain pasta or whole grain bread. Or you can do like a 7-day recall, I think, but can you remember what you had for breakfast a week ago? Probably not. I definitely can't. So these 24-hour recalls are probably more effective, because we probably can't remember what we ate in the last 24 hours, but it's then not giving us much time to really look at the diversity of a diet. So, you know, how much diversity have you had in 24 hours? You know, personally speaking, not very much, but if I look over a week, you know, hopefully my diet would look a bit better. You know, I'm having more plant diversity as well. So there's pros and cons of all of these. And that's why I think AI is going to be great, because we can avoid these stumbling blocks, hopefully, to some extent. And it's not going to be perfect, but I think it's going to be an improvement from what we've currently got. So we also haven't really spoken about SMART goal setting. So I'm sure you've heard of this. This way of setting goals has been shown to be the best way and for people to stick to the goals that they want to make. So we have to make sure that the goals are specific, measurable, achievable, relevant, and time-bound. You've probably heard about SMART, so I won't go into that too much, but obviously we have to make sure that we really got down to nitty-gritty of breaking that goal down into actionable steps. And of course, yeah, we need to make sure overall we're really encouraging for people, and it's not just enough to know what you should and shouldn't be eating. People really need to be encouraged along their journey. And just touching on ethical and legal considerations. So we have to obviously make sure we're maintaining confidentiality and privacy at all times. So that's protecting client information and storing it correctly, obtaining informed consent before disclosing any personal data, making sure we have really robust security measures, and we've got maybe the client files in a double locked, password protected file. And yeah, that's really important to prioritize, in general, to prioritize confidentiality, just to build up people's trust as well, and for our own integrity of a brand, if we're trying to build a kind of nutrition brand. And then scope of practice and professional boundaries. So we need to understand the limits of our expertise, what we can and can't do. So recognizing when to refer clients to specialized professionals. So for example, nutritionists deal generally more with public health issues, whereas dietitians, I always used to get confused about this before studying. What's the difference between a dietitian and a nutritionist? Well, dietitians generally deal with, in a hospital setting, of diagnosed conditions. So it's going to be a lot more medicinal, really. It's going to be much more focused on enteral nutrition and, you know, the tube feeding, things like that, depending on what you're doing with dietetics. But, you know, a lot of the time they're dealing with, perhaps more chronic health conditions, and nutritionists deal with more public health, overall health and well-being, kind of on that sort of level. And yeah, really we can collaborate with other healthcare professionals as well. That's great to do, and I try and do that as much as possible. And yeah, I think that covers that point. And then adhering to evidence-based guidelines and practices. So really important in this field to stay updated on current research, and which is always changing. So someone said to me, if you want to be a nutritionist, like, you're going to have to be okay with like lifelong learning, because the scope is always changing, and you know what's a consensus one day is often changed the next. But also it's very difficult because there's often research that will quite strongly say one thing for will have both sides of the argument quite strongly. So if, for example, using the example of banana, we could look up as to why bananas are amazing for us, and we could find loads, hundreds of studies, but also we could probably find studies that say the opposite. So it's a difficult field for that reason, because there will always be research behind both sides of the argument. And, you know, we could go into the reasons why. You know, there are, you know, sometimes motivations behind some of these research studies, and they can be funded by certain groups. But yeah, it does make it, the discernment is really important in this field. So yeah, CPD, so continued professional development. Personally, I have to do 30 hours a year for my registration, which is the Association for Nutrition. That's the British-based one. It's a or it's a voluntary register. So it's not essential that you're on it, but it is a good idea to be if you want to be reputable in your field. So it's not a protected title. Anyone can call themselves a nutritionist at the moment, unfortunately, in the UK. Hoping that's going to change soon. And so unlike a dietitian, that is a protected title. So yeah, it's a different register, that one. But yeah, that's the problem at the moment, is that it's not regulated. And yeah, that's why we have to be particularly vigilant on making sure our knowledge is up to date if we're wanting to, you know, hold a high standard for nutritionist as a title. So I'm coming to the end now, really, and I guess that leaves about 10 minutes for questions, which hopefully works quite well. I can see there's 18 messages in the chat, which is brilliant to see. So I will have a look through these, and yeah, thank you so much for listening today. And yeah, I would really love to answer any of the questions you have. So anyone else, please do add to that. I'm just gonna, if it's okay, stop sharing so I can see the questions and pass you back.
Question. You can use the hand reaction to leave the question or leave a comment in the chat.
Sure. Sorry, can you repeat that one more time?
If any of you have a question, you can use the hand reaction or leave a comment in the chat.
I see someone has sent a message. So any type of food that can improve the memory if consumed for some time. So yes, omega-3, I believe, is a brilliant one for our brain health and memory. And you know, all these fatty acids are excellent for brain health, and polyphenols as well. So antioxidants are really amazing at keeping inflammation down in the brain, which is really important for slowing any kind of cognitive decline as well, and definitely boosting our memory. And I love things like nootropics as well. I don't know if anyone knows this term, nootropics. It's things like lion's mane, you know, mushrooms and things, amazing for boosting our cognitive function. Great, thank you, Oscar. Pardon on nutrition education techniques. I only noted number 1. Oh, would you like me to go back? I can try and find my presentation slides and just go back to those shortly. Let me just look at the other question. I have one question. What do you think about Calavita? Never heard of this. Or Herbalife, I have heard of them. Is it healthy to consume this supplement in our everyday life? Do you know, I'm not too sure about Herbalife's products because they're not huge in the UK actually. So I'm afraid I can't comment on either of those. I mean, they're suitable to consume every day. I would assume that they've created them that way, but I don't know exactly any more about those. So sorry about that. Thank you so much, everyone, for your comments. Asking for my email address. Yeah, sure. Anyone would like to send me an email? I don't know if I had this on my slide. 1 second, I can get that back up. I did actually. So let me just, if it's okay, I can just share my screen again. Antonella, is that okay?
That's okay.
Okay, thank you. Okay, so my Instagram is there as well, social media and website, and my email address as well. So yes, I'll be very happy to have any further questions that you have. Would be more than happy to answer. And let me try and get back.
Rebecca, we have a question from Emmanuel Ulrich. Let's see what he has to say.
Sure, I can't seem to get onto the chat without, oh no, it's okay, I've got it.
Okay, yeah, thanks a lot for the presentation. Yeah, So it's so timely because we need to eat right and look healthy because health is actually wealth. So, but we've seen lately that many kinds of food that people eat, they only get to find out that this kind of food is not good for their health, and meanwhile they've been eating it all their lives. So, how do we get to know beforehand that this kind of food they are not good for our health, so that we don't indulge in them? So, is there a way to kind of mitigate the kind of occurrences?
Sure. No, thanks for your question, Manuel. That's great. So, you're asking about so people kind of maybe their whole life eating a certain way, and then they have maybe a health scare or something happens, and they think, "Oh my goodness, how's this happened?" Or, how could I have prevented this happening? Is that kind of what you're asking there? Yes, sure. So, yeah, I think with our Western diets, we have to be very careful. We have to take health into our own hands, right? Because unfortunately, our healthcare system, as amazing as they can be, they don't always know a whole lot about nutrition, or they don't. And our food industry is laden with these kind of foods, which are, to be honest, not going to be health giving at all. So we have to educate ourselves on ingredients, I think. So, for example, there's things like Starbucks food. I'm going to say like convenience food. There's a lot of preservatives in them to help keep them shelf stable. And really, we need to be careful about not having too many of those kind of maybe preservatives in our diet, or things that are laden with maybe vegetable oils. I'm going to say, for example, we have a lot of omega-6 in our diet, which brings inflammation to the body. So our ratio of omega-3 to omega-6 is completely not what it should be. We're not having enough omega-3. We're not having enough of the healthy polyunsaturated fatty acids like olive oil, avocados, nuts and seeds, all this amazing, these amazing whole foods. And we're having too much of the omega-6 fatty acids, which generally are found in things like rapeseed oil, or vegetable oils in general, which they are in a lot of processed foods. So we need to eat food in their rawest form, essentially, the most unprocessed form that we can find, basically. But it's a bit of a minefield, I'll be honest, because if you look on the back of any packaging, you'll see a whole list of ingredients, and most of the time we won't know what they are, right? So it's really hard. It is. But if you can educate yourself a bit on what some of those ingredients are, and the less ingredients, the better generally. So thank you for your question. Thank you. Yes, I can send the slides, or perhaps they're able to send this to you if I send the slides over. I think they'll be able to do that for you.
Yes, the slides will be available in the student section soon. Do anyone else have a question? I have one here from Kazuba Diniz. He says, many people complain that drinking sodas cause disease. It is true?
So is this diet sodas or normal ones, or both? I mean, I can answer for both. So we know that normal, say normal fizzy drinks, they do have a lot of sugar in. We know that. And of course, they're going to be absorbed quite quickly, the sugars in them, because there's nothing else in, there's no fiber, there's nothing that's going to slow down that absorption. It's going to cause a spike in our blood sugar. Insulin's going to come in, but long term, if that's happening, our insulin is going to become very resistant to those sugar spikes, and that's when things like inflammation and obesity and weight gain is going to happen. So yeah, I mean, fizzy drinks are fine every now and then, but they are not a great idea to be having every day, because they provide nothing very good for us at all. So, and then diet sodas, I mean, we have, as you probably, a lot of you know, there's like these artificial sugars, artificial sweeteners in there, things like aspartame. And although they are in low amounts, we know that aspartame it does have links to cancer, and it's not health promoting at all. So we do need to keep those low. It can be affecting our gut health as well, these artificial sugars. And if our gut health is not good, that has an impact on lots of things of how we're absorbing nutrients. So, with the body, it's very much we eat one thing and it can be linked, the knock-on effect can be linked to lots of different areas. And our health can be quite, it's complex, all these things, but yes, it's again a moderation. I mean, if you're having it every now and then, totally fine, but yeah, a litre a day, that is, it's not going to be good in the long run, of course.
We have another question, and we can make this the last question because we have only 2 minutes. On daily basis or weekly, what meals should not be missed in order to maintain body balance?
Okay, so this is a good question. So to kind of reach our maybe like body set point, which is maybe what you're referring to here, where our body's kind of happiest being in that maybe particular weight or fat percentage. So on the daily basis or weekly, what meals should not be missed? So I would say my main thing would be fiber, to make sure you're having 30 grams of fiber a day, and to have a goal of 30 different plants a week. Sounds like a lot, I know. So different plants, not the same. So plant foods being fruits, vegetables, nuts, grains, seeds, legumes, and herbs and spices as well. They all count. So these things are so important for our gut health. And fiber, it's not particularly interesting to people maybe, but it's a fundamental important part of our diet that people aren't getting enough of. Should I answer this last question?